I'm Dr. Kevin Revis, and I am the SAGES champion for the Providence Surgical Simulation Institute. In this video, we will demonstrate and review the 5 tasks associated with the fundamentals of laparoscopic surgery. Our goal is to give physician assistants manual skills training and have them become comfortable with learning and practicing their laparoscopic skills. Task 1, peg transfer. The purpose of this task is to orient you to working in a 3-dimensional environment, but seeing 2-dimensional on the screen. To complete this task, you will move the 6 triangle blocks from one side to the other and back. Pick up a block using the Maryland dissector in your non-dominant hand. Transfer the block midair to your dominant hand and set it down on the opposite side. Repeat for all 6 blocks. Then move all 6 blocks back to the starting position using the same method. Maximum time allowed is 300 seconds for this task. Timing starts when the first object is touched and stops when the last object is released. Proficiency level is 48 seconds with no objects dropped outside the field of view. If the peg is dropped outside the field of view, you will not be allowed to retrieve it. Penalties are assessed when an object is dropped outside the field of view or is unretrievable. There is no penalty for dropping the peg within the field of view unless you are unable to retrieve it. If you can retrieve it, the peg must be picked up with the hand it was dropped with prior to continuing the task. Task 2, precision cutting. The goal of this task is to cut the circle out of the gauze pad. Using the dissector in one hand, you will hold the gauze, providing traction. With the other hand, you will use the scissors to cut into the gauze and then around the pre-marked circle carefully and completely removing it from the pad. Maximum time allowed is 300 seconds for task 2. Timing will start when the gauze is first touched and will stop when the circle is completely released from the gauze frame. Proficiency level is 98 seconds and all cuts are within 1 millimeter of the circle. Task 3, ligating loop. The goal of this task is to place the ligating loop around the pre-marked structure. You will position the loop around the mark and tighten it down, cutting the end of the loop material off. You will have a maximum time limit of 180 seconds to complete this task. Timing starts when the first instrument or loop material enters the field of view and will stop when the end of suture material is cut. Proficiency level is 53 seconds with the loop secured within 1 millimeter of the marked line. Penalties are assessed for any deviations of the knot from the mark on the foam organ or if the knot is not secured on the appendage. Task 4. Extracorporeal knot tying. Taking a long suture and your needle drivers, you will place the suture through both ends of the Penrose drain and tie 3 single throws extracorporeal. You will utilize the knot pusher to secure each throw onto the Penrose drain. Then you will cut the excess length of suture. There is a maximum time limit of 420 seconds for this task. Timing will start when the first instrument enters the field of view and will stop as soon as both ends of the suture material is cut. Proficiency level is 136 seconds. The suture in the Penrose drain must be within 1 millimeter of the dots. The knot is secure and the slit is closed. Penalties are assessed when there are any deviations of the suture material from the 2 marks on the Penrose drain, the slit in the drain is not properly closed, and/or the knot slips or comes apart when tension is applied to it. It is an automatic fail if the Penrose drain is separated from the suture block. Task 5. Intracorporeal knot tying. Taking a short suture and your needle drivers, you will place the suture through both ends of the Penrose drain and tie 3 knots. The first knot will be a double knot and the following 2 knots will be single knots. After, you will cut the excess suture. You will have 600 seconds to complete this task. Timing starts as soon as the first instrument enters the field of view, and once both ends of the suture material are cut, timing will stop. Proficiency level is 112 seconds. The suture in the Penrose drain must be within 1 millimeter of the dots. The knot is secure and the slit is closed. Penalties are assessed when there are any deviations of the suture material from the 2 marks on the Penrose drain, the slit in the drain is not properly closed, and/or the knot slips or comes apart when tension is applied to it. It is an automatic fail if the Penrose drain is separated from the suture block.